I'm broadcasting from my home tonight as 11 Alive tries to support the statewide effort to work from home. So there might be a slight delay between my questions and the mayor's answers. Mayor, thanks for the time. You're part of the state coronavirus task force, and I understand you've made some recommendations on your subcommittee related to the homeless. Can you update us on those?
Sure, and thank you for staying at home. I want to thank the governor for asking me to serve on this committee, and this was a high-level working group consisting of people across the state, all with very valuable input. And also thank you to Catherine Marchman and John Keene for helping to lead this effort. What we did was come up with a list of 6 objectives to pass on to the governor as it relates to our homeless population. We know that our homeless population is a very vulnerable population just by virtue of the fact that they are homeless. They often have underlying health conditions that we've discussed that make them more susceptible to severe illness as it relates to the coronavirus. So what we did was to create a list of 6 objectives that we wanted to achieve. Those objectives included preventing additional people from becoming homeless, supporting enhanced cleaning, screening, and referral services, expanding testing for high-risk individuals in areas, establishing a reporting process specific to homeless and displaced persons, ensuring appropriate options for quarantine and isolation are available, and also ensuring that transportation options are available for people after they are released for the hospital. And I'm very pleased to say, as the result of the work that we've already done, we've had an angel donor in the downtown area who has donated a hotel to allow homeless individuals who may need isolation or quarantine to allow them a place to stay during that time. It also gives our service providers an opportunity to come in contact with the homeless population and make sure that we are making available to them additional wraparound services that may be helpful as we try and navigate them away from homelessness.
Yeah, so many people going through such difficult times. You were one of the first cities to implement the stay-at-home order, and I understand a lot of cities have been reaching out to you asking questions. Do you expect others to follow suit, and would you recommend that they do that?
If it were my call, I would have a stay-at-home order for the entire country, but obviously that is not my call. And I certainly understand and respect the governor's position that he is balancing diverse constituencies across the state, and their needs may be a bit different than ours. But as it relates specifically to the metropolitan Atlanta area, I think that many of the cities surrounding Atlanta certainly have many of the same issues that I saw in Atlanta. Many of our communities have underlying health conditions like asthma. I have 4 children in my house who are asthmatic. We know that's an underlying health condition. Whether it's high blood pressure or diabetes or respiratory issues or lupus or any number of other issues. And so I think especially for our more densely populated cities like Atlanta and our surrounding cities, I do think a stay-at-home order would be appropriate. But I certainly understand that there are many other cities throughout the state that are not navigating the same challenges that we are in the city, and I understand and respect the governor's decision.
We're hearing from medical professionals in different hospitals that they are already crowded and the ICUs are struggling. We heard from Grady on Monday that they were at the tipping point. Talk to us about plans that you have in place for some of our state's largest hospitals that are in your city.
And we have to remember that Grady is already in a compromised position because of the flood a couple of months ago. And on any given day, Grady may be near capacity. The anecdotal information that I received just yesterday was that Grady was around 90% at capacity in its ICU. So we have to remember, in the midst of this coronavirus, heart attacks don't stop, car accidents don't stop, any of the number of other things that send people into the ICU. So it is of tremendous concern to me, and by the projections that I've received from Dr. Carlos Del Rio at Emory, at this rate, we will exceed our capacity in the state by May 3rd. But certainly it's our hope that with these proactive measures in place that we can stop and slow down the spread of this virus. But in working with the governor, who has been a great partner in leading this effort, I know that there are plans already in place to expand our footprints at many of our hospitals, and I know that many sites have been reviewed as secondary places that we can house people if necessary. But it really is my prayer that it does not come to that in this state, but I certainly trust that with the leadership of our health partners and with the governor's leadership that we will be prepared in the city.
And it goes without saying, we cannot thank enough every person in our medical professional field, every healthcare worker, for all the work that they're doing day and night under really challenging circumstances. Mayor Keisha Lance Bottoms, thank you so much for the time tonight.